Hello, everyone. Today, speak of my class clinic. Is my pie of urinary tract infection. My name is Ricardo Avalos Vazquez. The theme of speak in presentation is clinic case, jus- justification for case selection, diagnostic, intervention, activities, and conclusion. The clinical case is patient information is woman 47 years old, high blood pressure, control with losartan, reason for admission, fever for 3 days, pain when urinate many times, right back pain going to the low belly, normal pain pills did not help, symptoms, burning when urinate, urgency the urinate, chills, felt tired. Physical exam, temperature 38.5, air rate 98, respiration rate 20, blood pressure 1030 and 85, pain in lower belly, pain in right kidney area. Laboratory test, height, weight, blood cells, urine, many white cells, nitrate positive, many bacteria, urine culture in process. Treatment, normal diet, IV fluids, meropenem 1G IV, amicacina 15 micrograms intra-IV, paracetamol 1G IV, check vital sign, relative rest, follow labs and culture. The justification for case selection it shows this case because it is a common but serious urinary infection that may affect the kidney. The patient has fever and pain and needs fast treatment. This case helps us learn how to recognize symptoms, check lab results, and give the right antibiotics. It also shows why early diagnosis is important to prevent complications. My three priority diagnosis of NANDA is uh, hyperthermia relative to infection process as evidenced by altered heart rate, tachycardia, temperature 38.5. Second is impaired urinary elimination relative to urinary tract infection as evidenced by dysuria, difficulty urinator, increased urinary frequency. And three is acute pain relative to biological agents as evidenced by verbal reports of pain altered psychological parameters, facial expression of pain. My priority diagnostic Dinanda is Domain 11, Safety Protection, Class 6, Thermoregulation, Codic 00007, page C66, hyperthermia relative to infection process as evidenced by altered heart rate, tachycardia, temperature 38.5. This diagnostic is used because the patient has fever from infection. She has a temperature of 38.5 and fast heart rate. This sign shows that her body cannot control temperature well. My intervention NOC is infection severity, dominion psychology health, class immune response, pruriria is the urine show pruriria. This means there is a strong inflammation in the urinary tract. Fever, the patient has fever of 38.5, with chills, the show a strong infection and high risk of complication. General discomfort, the patient feels tired as chills, malaise, and incomplete urinates. This affects her daily functions. Pain, she has back pain that goes to the lower belly and strong dysuria. It is constant, strong, but not disabling. Lethargy, she looks tired and immediately lethargy because of fever and infection, but she is still alert. An activity sneak is hyperthermia magnetic, fear, thermoregulation, class, complex psicológico, amply called methods monitor temperature, air rate, breathing, mental state comfort, and lab result. He ordered medicines, log for infection sick in older adults, even without fever, and corrige fluid intake. Second need is medical management, field complex psychological, class medication control, if the correct medical as ordered, monitor how the medics work, check in the patient follow the medication schedules, check if the patient can take medicines alone or needs help the patient make lifestyle change relative to medication. Three, infection control, field safety, class list, risk control, use a single room if needed, teach hot washing when turning and realistic the room, use infusion and fluid equipment for only one patient, teach patient and family how to prevent infection, if antibiotics when in the in conclusion, the patient has a strong urinary infection that cause fever, pain, and problem with urination. With the correct treatment, IV antibiotics, fever control fluids, and nursing care, the infection can improve and complication can be avoided. This can show a fast and efficient nursing care helps reduce fever, control pain, and improve urinary function. Thank you for your time.